Hey everybody, Ian from WardCode here. Today we're going to talk about harm reduction and its application within homelessness services and housing support programs. Seems to be a fair number of myths and misunderstandings, and hopefully we can clear some of those up today so that we can go on to supporting people in ways that are very person-centered and strength-based and truly meet people where they're at. Harm reduction doesn't have a universal definition. It does have a series of agreed upon principles and a framework within which it operates. To operationalize it within the setting of homelessness and housing programs, and specifically related to substance use, we should see harm reduction as a public health response to try to reduce the negative consequences of participating in high risk behavior, all the while trying to keep people safe and minimize the likelihood of death, disease, and injury. In a harm reduction approach, we look at programs, policies, strategies, and activities that'll actually reduce harm associated with substance use without requiring people to stop. It respects people's autonomy, their right to choose whether or not they're going to continue to use, and if they are going to continue to use, what we want to do is engage in meaningful relationship, the meeting people where they're at part, to try to educate and make aware of strategies, approaches, and techniques that they can use in their own personal life to decrease the impacts of their substance use. Let me give you the short answer. No. Harm reduction does not encourage use. It merely accepts that some people will continue to use and may never stop using. We all benefit. Yes, the person who uses substances benefits, but so too do service providers. The ability to meet people where they're at without judgment increases the strength of the relationship and can help people look at alternatives to substance use or reductions in substance use. The community benefits. It decreases harms to the broader community and decreases the reliance and volume of services that are used by the likes of police and health services. Harm reduction is not the same as efforts to legalize drugs. They're different things. Within a harm reduction framework, it's accepted that drugs in their various forms that we're talking about are illegal and likely will remain illegal, and that things like age restrictions and alcohol will continue in our society. Comes down to what you meant by enable. Maybe you meant it in a positive sense, to make able. In which case, harm reduction is absolutely enabling. It enables people to be safer in their use. It enables people to use less. It enables people to use safer substances. It enables people to have access to clean works, all of which are positives. There's a range of different approaches. And ultimately, it'll come down to what is palatable to your organization and what's palatable to the community in which you serve. If, for example, we included cigarettes as a form of substances that are used, you might start with something simple like making sure rolling papers are available to people who go and collect used butts so that they are taking the tobacco out of those used butts and re-rolling them as opposed to putting their lips to the same filter that someone else did. Related to things like alcohol or other substances, you could ensure that your shelters are accepting places for people who have been using and that staff are trained on how to support and monitor people in such a condition. Then there's the other extremes. You could be a distribution site for the works. You could do needle distribution or needle exchange. You could make sure sharps containers are available throughout your facility. You could make sure all staff are trained and equipped with Narcan. You could even look at things like managed alcohol programs, medically supervised access to alcohol within the shelter facility. You could look at things like amnesty totes, the ability for people to come in and to store their belongings safely without staff knowing what is being stored and without people actually having alcohol or other substances on them on the premises at all times. But that's going to decrease things like binge use before people come into your facility because they know that their product is safe and they can get it upon exit. There's not one size fits all. And that's just a smattering of examples that you could use. Sometimes what it really requires is thinking through easy things. Like, if someone needed to use at 2 o'clock in the morning, could I allow them to exit, go off property, use, and come back without making it a big rigmarole? When we think about harm reduction, we think about strategies in homelessness and housing programs, just think of it this way. If I want to meet the most people where they're at who use substances, what do I need to change in my programs and services to meet their needs, as opposed to expecting sobriety, cessation, or abstinence on their part to use our programs? Harm reduction is not anti-treatment. It's not anti-prevention. It's one of the pillars in a community-based response to alcohol and other drugs. Where treatment is concerned, it may be of interest to some of you to know that there's evidence from the harm reduction literature that people are more likely to accept treatment options and drastically reduce or even stop using if you start with a harm reduction approach, as opposed to an approach that requires compliance with abstinence, sobriety, and cessation. The short answer is absolutely yes. Housing, with appropriate supports, is fantastic at reducing all sorts of harms, including harms associated with use of alcohol and other drugs. In fact, with the right level of support and the right service orientation that is actually anchored in harm reduction, we can see dramatic changes in people's substance use. We can see people actually move towards improved health, and we can see people having long-term sustainability in housing.